Welcome back to our nursing series. Today, we're learning how to give a safe and effective intramuscular injection. IM injections deliver medication deep into the muscle for faster absorption. We'll cover preparation, technique, site selection, and safety tips so you can confidently administer injections in your clinical practice or NClEX exams. First, gather your equipment: syringe, correct needle size, medication, alcohol swabs, gloves, and a sharps container. Always check the 5 rights: right patient, right medication, right dose, right route, and right time. Choosing the correct site is crucial. Deltoid, upper arm, 0.5 to 1 milliliter, vaccines. Ventrogluteal, preferred site for adults, up to 3 milliliters. Vastus lateralis, lateral thigh, up to 3 milliliters, great for children. Avoid the dorsogluteal site if possible. It risks sciatic nerve injury. Draw up the correct dose using aseptic technique. Remove air bubbles carefully. Double-check the medication label and dose before proceeding. Clean the skin with an alcohol swab in a circular motion and allow it to air dry. Avoid injecting into areas with rashes, bruises, or infections. Hold the syringe like a dart. Stretch the skin slightly or use the Z-track technique for oily or irritating medications. Insert the needle at a 90-degree angle quickly and steadily. Aspirate if required according to facility policy. Inject the medication slowly and evenly. Withdraw the needle smoothly, apply gentle pressure, and cover with a bandage if necessary. Do not rub the site for medications that may irritate tissue. Dispose of the needle immediately in a sharps container. Distract or reassure your patient to reduce anxiety. Rotate injection sites for repeated injections and monitor for any adverse reactions. Always observe for 15 to 30 minutes if needed, especially with new medications. Document medication, dose, route, site, time, lot number, and patient response. Note any adverse reactions or complications. And that's how you safely give an intramuscular injection. Remember, prepare properly, choose the right site.